Hi, my name is Megan, and I'm a student nurse from Louisiana College, and I'd like to talk to you today about Picc line care. To prevent infection, proper hand washing is essential. Do not be afraid to tell your nurse to wash his or her hands because it only takes 15 seconds of using soap and water or an alcohol-based hand rub to kill the germs that causes infection. For your dressing, a secure, clean, and intact dressing is essential to prevent catheter migration and infection. The dressing should be changed every 7 days or more if needed. It is often necessary if a friend or family member is taught how to change the dressing, even if home health is used to ensure that the dressing remains dry, because a moist dressing is a perfect breeding ground for infection. Check your dressing daily. If it is wet, soiled, or leaking, make sure you change it. But also, never use scissors because of the possibility of cutting the catheter in error. This is a picture of a normal dressing. Notice the date on the dressing. This is to ensure that the dressing is changed within the 7 days or as needed. Flushing the catheter. Remember to flush your catheter every 12 hours and after every use. This is required to prevent any clogging of the catheter. Clean the catheter with an alcohol prep pad prior and after every use. If flushing is difficult, this might indicate that the Picc line is becoming blocked and you should tell your nurse immediately. When not in use, the catheter should be cleaned. Health hints. The arm of the Picc line must not be babied. It is actually, in fact, increases blood circulation in that arm when it is in normal use. This aids in carrying medications to the heart for systematic circulation. However, strenuous work such as lifting objects greater than 10 pounds or repetitive motion should all be avoided. When showering or when in water, make sure you cover your Picc line with some type of plastic such as a waterproof cast that covers and works well. Do not let the ends of the line hang in the bath water. Always tape your line to your arm to prevent it from sagging on objects. If you have any problems with your Picc line, such as fever, chills, soreness, redness, or pus at the line, or a swollen arm, this might indicate that you have an infection. You should call your doctor and make sure to take your temp. If you have any leaking from the line, this could be an indication that the cap on the Picc line is not screwed on tightly, or you might have a hole in the line. Tighten the injection cap and check for a tear. If you see a leak in the line, clamp it and fold it over and pinch between the leak and the skin and call your nurse. If your Picc line accidentally comes out, press down on the site for at least 5 minutes. Apply antibacterial ointment and cover it with a bandage. Call your doctor or your home care nurse. Redness of the skin could indicate you have a sensitivity to the tape. You might have to change your dressing and choose a different type of tape. Redness or tenderness to the upper arm might indicate that you have mechanical phlebitis, which is also vein irritation from the line. This is not an infection. You can apply warm packs and notify your doctor or your RN. If the length of the exposed line is increased, this could indicate the line has been pulled out partially or completely. Do not push back in the line, cover with gauze, and call your nurse. If you hear a whooshing sound in the ear, numbness or tingling in the arm, discomfort of the jaw, face, and Picc on the Picc side, this could indicate that the line has moved or the line is causing nerve irritation. Stop the medication and notify your RN. Here are some other reasons to call your nurse or doctor. Thank you. Have a nice day.